just to explain, there's two ways in which the CaLP envisages that this tool will be used. One is it will be open access on CaLP's website, and will encourage organizations to go through a process of self-assessment using the user guide which Mike will be presenting. And we'll be building in a system for feedback on how the tool was used and the types of recommendations that emerge from it in order to refine it further. And the second approach will be an institutional support package which CaLP will deliver to targeted organizations, and it will be framed by the OCAT, by an OCAT assessment either side of the process. So over the coming months, we're aiming to pilot that at global level as well as a regional level, and to develop relevant packages of tailored training and leverage the relevant technical, operational, or strategic expertise to address the capacity gaps identified. Another good piece of news is that we're recruiting dedicated capacity in our capacity building team to focus on this institutionalization process. So that's a little bit of background in terms of why CaLP has decided to focus on this and what our plans are for the coming year. And now I'll hand back over to Mike. Thanks.
Okay, thank you, Isabel. Thank you for that. Isabel Pelly from Cash Learning Partnership. Again, if you just joined us, my name is Mike Daniels. I'm the consultant on this CaLP Cash Learning Partnership project to revise the organizational capacity assessment tool. Just quickly for those that have joined us, I'm going to be going through the work with the tool and content. I'll explain that a little bit. Just basically a series of PowerPoints that I'll be briefly talking through, and then there'll be time at the end for some brief questions. If you have already seen the tool, you've been to the CaLP website and have downloaded the tools, you can go through, and I'll periodically give the page numbers that I'm referring to, and you can go along with that. But you don't have to have that in front of you if you don't need to. The content of the slide pack here and what I talk will hopefully be sufficient. So with that, let's get underway. What we're going to go over here briefly today is a little bit of the background, again, as Isabel has already mentioned. So we'll skip over that in terms of what the organizational capacity assessment tool is. But we'll get into what the purpose, a bit more detail, the purpose and the intended use of the tool. We'll look through what's in the tool itself and what's in the user guide, so the format and the content, talk about that. Talk about the process to prepare for and use the OCAT tool and the workshops that go with that, the assessment process. And then I'll give some examples. We'll walk through some just very brief examples of how it can be used by some different types of organizations. And then again, once again at the end, we'll have some time for any sort of key questions to clarify what we've talked about. So moving right along. The Organizational Capacity Assessment Tool, again, as Isabel mentioned, is really intended for organizations to self-assess. It's about identifying what capacity is in place, what capacity is not, and therefore is needed in key functional areas. So that's, you'll see the list, but it's like leadership, it's human resources, program, it's financial controls, etc. And of course, you can use this tool to both plan improvements and to measure your progress as you go through, using it in a repeated way to measure your progress that you're making. It's not intended as a performance evaluation, like as an external for management to evaluate staff, or for other organizations to evaluate your performance or your organization or your unit. It's very much intended to be a self-led process on behalf of an organization or units variant. And again, it's not intended to be really something that can be compared directly across different types of unrelated organizations, because by nature this is somewhat of a subjective approach, and so of course, again, it's for internal growth, internal assessment and learning and planning, not as a comparison across organizations. So the tool is designed hopefully for organizations of any size or any type, whether they're a headquarters office, whether they're a small agency, a small NGO in country, or a large NGO, UN, Red Cross, other agencies can use it. Of course, some of those do have their own tools as well. It can be used in terms of large organizations, like multi-member or multi-country organizations, could, for example, use it to work with their country offices by maybe coming up with some standard content or standard agreed definitions or targets and so on. And then they can have their various member organizations use. But again, it's not intended to be an external evaluation per se. They can be used by organizations that have, for example, implementing partners. They could support their implementing partner to use the tool and identify the areas of gaps, and then you can work with your implementing partner to help to address and to kind of measure against agreed benchmarks. So there's a variety of users, potential users of the tool. In terms of the format and the content of the tool, there's basically two documents. One is what's called the user guide, which you see on the screen there, which is a large PDF document. And then there are the tool worksheets. So the user guide has instructions about how to use the tool, descriptions of what you're being assessed, what is being assessed, and how to score. And it's a critical document that you'll want to use when you're doing the assessment process. It's not just for reading beforehand. It is something to use as part of your assessment process. The worksheets, some examples given there. There's a worksheet that is for the actual scoring, where you simply use it for the data entry process and for putting in comments and so on. We'll explain that later. There's a worksheet for graphing results. But when you enter your scores, the automate comes up with a series of graphs. And then is a worksheet with recommendations where the participants in the assessment process can make a recommendation about building capacity, think through implications, and so on and so forth. So those are the actual functional parts, or the parts of the tool itself. In terms of actual capacity assessment, for the purposes of this tool, it's just broken down into 6 different categories of organizational capacity. So governance and leadership, organizational management, in terms of org charts and structures and processes and so on, and then breaking it down by the more functional parts, so human resources capacity, financial management capacity, program management, and external relations, how the organization coordinates and works with key stakeholders. So those are the categories, and those are listed those are detailed more on page 9, summarized in the user guide. On page 9 is the summary of the categories and the criteria for each of those. So for each of those categories, there are a series of criteria. In the current tool, there's 3 criteria for each category. And here on the screen is an example of one of the criteria for the project management category. The criteria basically describe what capacity, what systems or processes need to be in place in order for an organization to be able to do or to implement or scale up cash transfer programming effectively. These are drawn from normal standard organizational capacity assessment processes and criteria, but with a specific focus on what about that needs to be specific to cash transfer programming. So what specific capacity needs to be in place. It needs to be in line with good practice in the sector or in the industry for cash transfer programming. And then obviously, if we're talking procedures, policies, and so on, they need to be known, they need to be used effectively, they need to be regularly updated. So the example given there, the criteria 5.1, is a typical type of criteria for we're talking SOP, standard operating procedures, or policies and procedures. Other criteria have different formats. Each of those criteria then has a series of indicators. And the indicators really go into quite a bit more detail about what we mean when we just define the criteria. So it gives more examples of what that might be. In this situation, it's talking about processes for needs assessment, for example, is one of the indicators under the SOPs around program assessment, program planning. It also, in many cases of the indicators, it also references the various cash transfer program good practice resources that are available. And there's also a bibliography on page 32 of the user workbook that lists those and others. I think it's important to recognize that in the cash transfer program sector, there are as yet very few actual standards, unlike the sphere of standards for humanitarian programming. In the cash transfer program, there are a few actual standards. There are a lot of case studies. There are a lot of good practice reviews and research, guidance tools, etc. That are very helpful and very useful. And so those have been what I've drawn on in terms of the resources around good practice. But again, so examples are given for a number of these indicators, and so organizations or staff doing these capacity assessments need to really look to those resources and others as they find or have to see what the good practice represents, and then assess whether their organization is doing that. Once staff have looked at the category, the criteria, the indicators, and read through those and the reference materials, then they're able to, ideally a participatory format, they're able to score the capacity of the organization. And so basically the criteria are broken down, the components of the criteria are broken down into four categories. So 1 and 2 generally are, nothing or not enough is being done around the systems or processes of capacity. So for cash transfer programming, 3 is a work in progress, and things are getting better and improving. And then 4 would be best practice. Basically, an organization is really operating at full capacity in relation to that particular criteria, in relation to that particular category. And I'll explain a bit more the process of how the scoring is done. But each of the criteria has 4 possible scores: 1, 2, 3, and 4. The scores are then, by being entered into the worksheet, the scoring matrix worksheet, the results are then automatically mapped onto these a series of results graphs. So there's one for each category that shows it as a spider web type graph, so you can compare the 6 different categories. And then each of those categories also has the 3 criteria also being scored here in blue. You see just an example of what some scores might be. One being in the middle, and 4 being on the outside. So the larger the size of the web, the larger the size of that triangle in this case, the better, obviously. And the final part in terms of the pieces of the tool is then the recommendations matrix. And so again, using the same example, we see the criteria 5.1, policies and procedures, etc. And that's transferred to this recommendations matrix. So after staff have discussed and done the assessment in terms of assessing their capacity and scoring, then they're able to discuss and decide on what recommendations to make to management or to the organization, including things around implications, cost, effort, timing, priority, and so on and so forth. And so this is simply a tool, a matrix, where that information can be documented and presented. Okay, I'm going to stop there briefly before I move on to the next section. Can I get those that are following along? Could you use your smiley face and give me a thumbs up or a thumbs down or a slower, faster, if as appropriate? If you're following along so far, if things are okay, if something too fast, too slow, or if you have any burning questions that need clarification. Okay. No, I don't see everyone there. I hope everyone can hear me and can follow along. But I did see a series of thumbs up and so on. That's great. Okay. Again, if anyone does have a burning question, feel free to type it into the chat, and I will will try to follow, try to respond. You can also, if it's really a burning question and it seems that I have skipped over it, you can also use your talk button and can ask a question, or ideally first put your hand up. The hand is one of the 4 buttons there, and I can call on you. But feel free to engage as needed. Okay, so moving on. I'm going to talk briefly about the actual process of how this capacity assessment can be done. It's important to recognize that the tool itself, the OCAT, is just really one part, should be one part of a broader organizational preparedness process. Obviously, the organization needs to be engaged and willing to assess itself and to do something about the results. If it's decided to implement or scale up cash transfer programming, it needs to be willing to invest the time, resources, and attention to be able to do that effectively. So it does, if you're a staff member or an office wanting to have your organization take part in this process, then obviously there is a lot of buy-in from senior management required, both in terms of agreeing to do the process, agreeing to participate as appropriate, or send and engage staff, appropriate staff in the process, and then again, as I mentioned, to be then open to the recommendations that come out and be able to take action on that as appropriate and resource it appropriately. So it's a broad process of organizational development, organizational preparedness, I should say. It's not just a single freestanding tool in terms of really doing organizational preparedness. So as I mentioned, using the tool itself, it's ideally intended to be done through a participatory process. For example, a participatory workshop. Some organizations might choose to use it as a survey tool, and that's fine too. But recognize that having the more people, obviously the more minds involved in this process, looking at the various criteria and indicators, and of course having the various functional and sectoral groups involved from the management side, program management, program and technical side, finance, HR, admin, IT, everybody that needs to be involved. It's not just a tool that the program staff would use. It is something that the entire organization should be engaged in at the appropriate level, and that would be both management and technical staff that have the understanding of both the broad picture and, as appropriate, the more detailed around what are the SOPs, what are the practices that are being used. So again, the more participatory the approach, the process used, the more likely to have a credible and valid assessment, and also, of course, a more useful set of recommendations that are likely to be able to be taken forward. Again, it's not something that should be done necessarily just by one person or one unit within an organization. In page 6 of the user guide, if you're following along, if you have that, is the section around on preparation, and it gives some tips and points about, and a bit more detail about how you would actually prepare for and run that workshop. So preparation is required to use the tool, and if you are doing a workshop, of course, it's pretty important to prepare for that. Key things for that really are looking at the concept of here's where the user guide comes into play. So reviewing the indicators, obviously the categories, the criteria, but then reviewing the indicators, the guidance notes that are there in some cases, and looking at the good practice materials, those that are referenced in the user guide, and or other materials that you have or you have access to. It's important again to really be able to understand what the criteria or the scoring represents. It's not necessarily self-evident just by reading it. It obviously covers a lot of different areas, so it is important to look at the indicators and guidance and reference the tools. If that can be done, in advance, obviously, of any kind of workshop, that participants do a workshop that would have a chance to also review the indicators, the guidance, and materials, the references, that would be helpful. And it's also helpful to ask them to then think through a little bit in advance about how they would assess their organization or their functional area or the policy, procedure, or capacity that's being referred to. And if they are able to bring evidence of what they have as existing capacity. So, for example, they could bring the policy, they could bring the SOP handbook that would show that yes, these things are in place. They could bring reports about training that was done or effectiveness of implementation of a particular activity or a particular capacity. So all those things are useful when it comes time to do the workshop to actually discuss, assess, and validate, or use an evidence base in effect for the scoring. For the workshop itself, then obviously it's important to have a facilitation plan and have copies or materials of the indicators, the guidance, and other materials available either in hard copy or in some form of presentation. Again, participants need to have the full scope of what's being talked about, not just the worksheet, not just the scoring matrix. They do need access to the content of the user guide. Now, the workshop could be done as a facilitated process with an external consultant or somebody from CaLP or somebody from headquarters or senior management. That's possible. It can also be done, obviously, with participants themselves. But it's useful to have some kind of lead focal person or a lead person to put together and plan and lead and facilitate the workshop. Again, some organizations might like to have an external impartial facilitator. Others, it's just part of the organization, and that's up to each group on how they want to do that. So once you're in the workshop or in the participatory process, then it's important that, again, as I mentioned, that to really look at the criteria in each category, look at the indicators, and share the good reference materials. If the criteria themselves are not clear to the participants, or if there's an opportunity to reach agreement on a specific definition of, for example, if the indicator or the criteria says all staff have been trained, or most staff are aware, or program or procedures are often used effectively, then defining those terms to the comfort of the participants it can be helpful. It's important then that process of discussion again involves the various functional groups, the various people with the knowledge and the expertise and the exposure to that capacity. Again, it's not intended to be an evaluation of other people's work. It's really intended to be a participatory discussion. And then using the criteria, the indicators, the guidance, and the reference materials, looking at and assessing, do we do this well? Do we have these systems in place? Do we have this capacity? And so on and so forth. Once the group has reached some sort of agreement, a consensus on that, then the score, the 1, 2, 3, 4, can be added into the scoring matrix. By looking at the scoring matrix, you can identify which of those 4 scored, which of those 4 situations best represents the current capacity. Is it nothing's in place, or is it for good best practice, everything's being done well for that particular criteria? And then explaining the decision and any evidence that goes with that in the comments column of the scoring matrix. So to have it back to our example of criteria 5.1 in the project program management, the discussion made aside that given the capacity we have in place, looking through our various policies and procedures, we believe for our organization that we fit 3, that we think we're pretty comfortable there. We're work in progress, still things to improve, but overall things are doing okay. And so we enter the score and document the reasons and thinking, and again, evidence, ideally, in terms of what actual SOPs are in place, what training has been done, what reports have been done or evaluations have been done that show that things are being done effectively. It's also important to gauge the level of agreement among the group, the participatory group that's discussing this. The nature of this process, it's intended to be as objective, as evidence-based as possible, but there is an inherent subjectivity to this, partly because many of the criteria are by necessity quite broad, but also just because of obviously human nature, three people looking at the very same situation might assess it differently, might have a different opinion. So it's important that having the group discussing and reaching some sort of opinion on the score. Ideally we're looking for a consensus, but the final decision may need to be some agreed method of reaching majority opinion, voting for it, some process like that the facilitator in the group can decide how best to fit. It's important to record to document and record the degree of consensus among the participants, because that will be useful for later when you're making recommendations, knowing how many participants in the group or what level of agreement among the group about a particular score, and that's important. Okay. I have a question or a comment here from. I have a question or a comment from Kelly. Says in similar workshops and training on mobile money, it was up to us and find enthusiasm by the organisation to adopt new procedures capacity. So I'm bringing evidence. Do you have any other tips on getting realistic scoring? I think really it's key about preparing the participants, and so explaining what it is that's going to be discussed. So again, if participants are able to review the materials in advance, and then really have them think about both the evidence they may bring, but also talk about the evidence. So talk about examples where they can explain where something has been done. They can talk about and discuss that process to reach some sort of agreement. Yeah, and that is very important. Okay, it is. I think it's an important process that be done like that. Okay. So the next step, once a group has reached agreement on the scoring, is to identify their recommendations. And so that, again, should ideally be as specific as possible. So again, looking back to the indicators, looking back to the reference materials, good practice materials, identifying what specifically has led to a lower score, and therefore what specific changes could be made by the organization. And then that's documented. And it's important also, of course, to identify what the implications might be. So for senior management taking those recommendations forward, there's consideration around the time and effort involved, what the expertise or supports needed cost, and things around likely resistance from the broader staff, as the case may be, and potential impact on other programs or other activities or other systems and capacities. And the issue around the resistance is an important one, because it allows, again, thinking around the level of agreement or consensus around a score also infers to an extent how likely there's to be resistance among broader staff, maybe staff that aren't involved in the assessment itself. So that's an important consideration. And then finally, of course, it's important to consider opportunities for when and how the changes could be made. So is there a need for advocacy, or is there an opportunity to link the suggested change, the recommendation, or the change itself to an annual planning process or other events or activities that are happening. Okay. So that's the process of recommendations. Again, on the issue around acceptance for the recommendations that have been given, is again looking back to the degree of consensus on the scoring. Obviously, if the score is relatively low, then improving that particular area of capacity can have a great impact on the performance of the organization. But also inherently means that there's likely to take a lot of effort, and it may well face internal resistance. Change requires change management. Hello, if you please don't have the microphone on. Somebody has their microphone turned on. So it's important to review the degree of consensus on the score, because a high level of consensus likely means that the score, obviously, the capacity, or therefore the need, is broadly recognized, at least by participants in the workshop, and hopefully if that's a representative group of staff across the organization, then that should imply that the change required should be readily accepted. Doesn't mean it's an easy process or a quick or a cheap process, but acceptance should be there if there's a consensus that yes, this is needed. On the other hand, if in the assessment workshop there's no real consensus, you couldn't reach any kind of consensus on a score for a given criteria, whether it's the high score or low score, then that obviously represents that there's need for further investigation. Either the staff or the participants don't understand what the existing capacity is in place, are not aware of it, or everybody, people recognize that potentially there's a problem, but they're not really quite sure what it is. So there's a further investigation, maybe going into further depth on that particular area of capacity or that particular criteria. So it is important to know, whether in your workshop whether there is high consensus or low consensus. Again, my take on this is that really it really is as objective and evidence-based as we can make it. But human nature being what it is, you get a group of 30 people together in a room, there will always be some level of discussion, some level of consensus or not, as the case may be. I don't believe it's possible to go to the level of extent of getting everybody to agree on the exact same score. That's useful and helpful if you can, but I think most importantly is getting people to recognize where the issues are, not fixating on the specific score, but really looking more on where the areas, where the gaps. So that would be some of my take on that. I'll stop there for a minute. There's a question from Bellette. Every response should be supported by evidence by rating 2 or 3 of a specific question. I agree, Bellette. Again, any participant at a workshop who says our capacity for in this particular area, our needs assessment, our market assessment, we do this really well. They should be able to bring evidence with that. Whether it doesn't have to be a documented report per se, but they should be able to say to the group, remember when, and the group nods in assent, nods in agreement. That's a kind of evidence, if not documented, but certainly a verbal consensus in the room that evidence exists for a scoring. In terms of why rating 2 or 3, there are, again, because of the nature of the tool, and there are so many aspects of organizational capacity, and of course so many aspects relating to cash transfer programming and the good practices around that. There's a wide range of things that each of these criteria and indicators can cover, and so it really is up to the discussion among the groups to say, are we 2, are we 3? And it's not necessarily an easy decision. It's something that has to take some time. So this workshop may be a 2-day process, a 2 full-day process to work through. Maybe less if a lot of preparation, pre-thinking has been done. But it's not something that can be done in a 1-hour staff meeting. It is a pretty involved process, and it is important, as you say, to get a meaningful assessment outcome. And again, ultimately, the score is less important than the understanding and the consensus, some degree of consensus in the room of where the gaps are, what needs to be done to improve. Whether it's moving from a 3 to a 4 or a 2 to 3 is really irrelevant. What's most important is that recognizing where improvement needs to be made. And that's, I think, the key point of any organizational capacity or capacity development process. Okay. So I'm going to last point of the organizational capacity process is really it's not part of the tool as such. It's now really the next step after an organization has used the organizational capacity assessment tool and the user guide and done their workshop and developed their plan of their recommendations. Then really the next step is for management, for the organizational leadership to develop some sort of plan of action. And that's obviously for them to agree, to discuss, decide, and agree what needs to be done, by whom or with whom, with what support, when, and in what order of priority. And like any strategic planning process, which is effectively what that is, the plan of action needs to be sufficiently resourced, or the activities within the plan of action need to be sufficiently resourced and rolled out and effectively done. So again, it's important to see the organizational capacity assessment tool as part of a broad process where the organization makes its goal, makes its plan for how it wants to, where it wants to improve or that it wants to improve, that there's senior management buy-in, that there's resources committed to the process, staff time and staff effort are contributed to the preparation and conduct and discussions of the workshop, that the recommendations are presented to senior management as appropriate, and that senior management is willing to put together a plan of action to implement the changes as and when they are feasible, able to be done within the work frames, cost budgets, and so on, strategic plans. And that's so it is an important overall process. Okay, a few minutes before we go open up to sort of just broader questions, I wanted to just go through very quickly just some examples of how organizations could use this. And obviously this is very sort of generic, very brief examples. An organization spending 2 days doing its assessment process and workshopping obviously would have more thoughtful and more detailed recommendations, for example. But just to give an example of the kinds of ways this could be used. So for example, we've got criteria 5.1 again, policies and procedures to determine the most appropriate response are in line with CTP good practice, and then those policies and procedures are routinely used effectively and include the areas of needs and market assessment, feasibility risk analysis, response options analysis, all key essential parts of determining what's the most appropriate response in a given context. So the indicators for that are, for example, one of the indicators includes processes for market assessment. So it refers to the notion of baseline, post-disaster analysis and market mapping, and so on and so forth. And gives the references of the CaLP minimum requirement for market analysis in emergencies. So again, it's one of the resource documents available on the CaLP website. So a country office, for example, of an NGO or an agency is in the process of reviewing its capacity and gets a sense that they don't analyze their markets very well. As they're looking through their indicators, looking into the process, looking at the documents, they refer to the CaLP document and they see that there are tips on understanding market dynamics better, so that you can better assess potential impacts, positive or negative, on a market from a cash-based or cash transfer program response. And so then again, as part of the process, the participants might agree that their SOPs are not strong enough in that area, that staff don't know or don't effectively use their SOPs, or that the SOPs themselves don't address these issues around market impacts, for example. And so they give themselves a lower score. Again, most importantly, they therefore recommend what we do. And so in this example, a simple example would be the revision of the SOPs. Obviously, being as specific as possible which part of the SOPs or which aspects of market assessment are they referring to, what aspects need to be built into their existing SOPs, along with then training for program staff, setting some sort of targets for when and how many staff would be trained. And then obviously there are thinking about their implications for budget and the workload, but they're also good thinking about the opportunities. Maybe they tie in with the monitoring and evaluation team, and then they use the results to be able to strengthen advocacy with senior management and donors, and so on and so forth. So that would be an example for like a country office. And example two, similar, so still in program management, policies and procedures for program design and implementation cash transfer program modalities. Again, they're in line with good practice, used effectively, etc. And this includes, for example, beneficiary targeting and beneficiary privacy, beneficiary data privacy. One of the indicators is about agreements and systems are in place so that the organization and all third parties, so financial service providers, mobile telephony providers, etc., mobile payment systems, are all taking appropriate steps to protect beneficiary privacy. And so again, there's a CaLP document, a reference document of operational standards, good practice principles for the secure use of personal data. So this is something that maybe the headquarters of a multi-country or larger organization might say, we have a concern that beneficiary data privacy is not being consistently done well, not being consistently applied across our country offices. So again, through this process, they may recognize that globally they lack a policy or they lack standard data management systems in line with the latest good practice or in line with donor expectations. And so they may say this is an area that we as an organization need to be able to do something about. So they may say they've already got strong SOPs and capacity in the other areas, but in this particular area they have a need. So they may still give themselves a score of 3, but in their recommendation they're going to be very specific that they need to roll out some kind of organization-wide data privacy policy, SOPs, and so on, and maybe to explore new technologies, data management systems, seek technical support from CaLP and others, and so on. And so coming up with a plan for how they would do that. And then the next step, obviously, is that then, in terms of rolling it out to country offices, they may then ask country offices to do the same process to assess, given the expectation or given the sort of the benchmark of data privacy. They may ask their country offices to assess themselves, and that can then be sort of centrally collected and compiled, so the organization gets a sense of where each country office is at, and therefore what needs to be done about it. So that's an example of where headquarters could use this for across its various country offices or member organizations with an association of some type. And the last example, very quickly, is again under programs, the third criteria: policies and procedures for monitoring and evaluation. Have the various information needed to analyze response effectiveness, efficiency, etc. And again, in line with good practice and used effectively. One of the indicators there is around assessing impacts on both beneficiaries and on markets. And so again, there's a variety of good practice materials available, including the good practice review from ODI, HPN. And it has a table that shows key questions for monitoring and evaluating cash projects, for example. So, for example, if there's an agency that gives grants, that works with implementing partners for cash transfer programming, it might want to ensure that those implementing partners have strong M&E systems in place to enable effective reporting, audit processes, etc., to know that they're being effective, whether it's cost efficiency, whether it's program effectiveness, and so on. The agency, therefore, will come up with some kind of plan to decide, well, we as an agency need to work on this with our implementing partners, and then we may commit to work with the implementing partners to support them to use the CaLP Organizational Capacity Assessment tool to assess their capacity, in this case around M&E systems, and monitoring impact on markets, for example. And then the agency can agree with its implementing partners what would be acceptable progress, or what would be acceptable results, what would be acceptable definitions of, how many staff need to be trained, what the systems need to include, what the policies need to include, and so on. So again, working with their implementing partners around some process of building capacity around that particular area. So that's another way that an agency could look at, a larger agency that's working with implementing partners could use the tool both internally, looking at itself and how it works with implementing partners, but also looking at supporting the implementing partners themselves to assess and build their capacity in some coherent manner. Okay, so I'm going to that's the end of the presentation as such. I hope this was helpful. We've covered briefly with Isabel the background of the tool, the purpose and intended users of the tool, the format and the content of some of the tool, a bit of a process of how to prepare and use, and then briefly some examples of use in 3 different ways, from a country office perspective, from a headquarter, or from a granting agency of some sort. So I'm going to open it up for questions there. I see there has been a rather running debate, as there often is in this sector, around assessment and evidence base and so on and so forth. I'm not going to wade into that. I think I've made myself, my opinions clear on how I've approached capacity assessment and with this tool. But I would like to open up to any specific questions more about the content of the tool, or how to use the tool in your context. So again, I think we have there's a question from Belette. Thanks for the examples. Interested to see how the tool will be used in a consortium arrangement. Okay, that if that's a question, I guess I would say this could be used like maybe my third example. If a consortium is getting together and deciding about cash transfer programming, each member of the consortium could obviously assess its own capacity and share share some degree of its assessment with the other consortium members in terms of where the gaps are, what the needs are. But ideally, if it's in terms of if the consortium is intending on doing some kind of joint programming or implementing programs in some consistent manner, then again, I think there's a need for those organizations to come together to look at the tool and to identify which parts, which indicators, or which good practices are need to be standardized or need to be agreed, and targets and so on for those. And so the tool can be adapted to suit that context. And then again, organizations individually and collectively could then look at, assess themselves across those sort of benchmarks, and assess individually and collectively how to move forward. That's how I would see doing something like that. There's a question from Jimena. Looking forward to test. Afraid that we need to do a lot of back-end job within the organization to be ready. Yes, I agree. Again, the process of doing this is not just inviting people to a workshop and using the tool. In order for the organization to be willing to take forward the recommendations that come out of this, there is again that whole process of senior management buy-in and resourcing. But certainly for the workshop itself, yes, there is a lot of back-end work in terms of the planners or the facilitators for the workshop, collecting material, collecting evidence, making sure that there's sharing the tool and the contents and so on, or being prepared with the workshop to be able to share the details of the tool. And there is work, again, preparatory work ideally for workshop participants, that they would read through, think through their own sense of capacity, so that they come to the workshop prepared. Again, each organization might do it differently. Some might have a longer workshop where they start from scratch and they introduce a tool at the beginning. Others may use a staff survey to survey the entire organization about what people think about given particular questions of concern, maybe, and then bring it together in some sort of workshop to decide how to respond to those results. So there's a variety of ways it can be done. But again, it is a process, and it does require preparation in order to do it effectively. Thank you very much for joining the Cash Learning Partnership presentation on the Organizational Capacity Assessment Tool. I hope it's been helpful. I wish you all luck with you and your organizations in using the tool to see how you can help your organization be better prepared to implement or to scale up cash transfer programming. So I'll leave it there. Isabel, if you're still online, did you want to make any final closing comments?
Yes, I just wanted to say, thanks all very much for your participation. It's great to see this so well attended, and also to see some of these thorny issues come out. But I think that we are fundamentally all seemingly aligned on this notion of consensus building versus evidence based decision making, and certainly we would really encourage those facilitating an OCAT process to ensure that it is based on as much pre-work and objective analysis of what is in place and what has been applied in respective programs. And we will be setting up a process for getting feedback from organizations who've used the tool as a self-assessment tool to ensure that it reflects your revisions and inputs, as well as providing more information on the institutional support package that CaLP will be launching at global and regional level. So we'll be updating you on all that in the coming months. So thanks, and a very big thanks to Mike